Welcome, welcome, everyone. Thank you for joining us today for this Lunch and Learn. Still see some people being released from the waiting room. I see some people I know. Excellent. All right. Well,
We're all gonna do a drink.
we will give another minute for folks to join in. It is Tuesday. We are in the middle of Maternal Sepsis Awareness Week. And whether you're joining here on your lunch hour or not in your lunch hour, we're thankful that you joined us today. We are very excited. So, on behalf of the Mama's Voices team, we're so thankful that you're all here today for this informative Lunch and Learn event. My name is Nicole Purnell, and I'm the program director for Mama's Voices. It is my honor to get to welcome you today to our discussion about maternal sepsis. It is my absolute pleasure to welcome our speakers from our Mama's Voices partner, Sepsis Alliance. Please take a moment to drop your name, your organization, and where you're located in the chat so our team can join in welcoming you into this space. All right, thank you. Just a quick overview of today, then I'll give all of you a quick overview of Mama's Voices program, and then we can provide to our various audience, then introduce our top-notch speakers before jumping into the meat of today's presentation on sepsis and maternal care. This is a topic that stays relevant in all the work that we are doing, and there are several states that are working on this right now and starting to work on this for their quality improvement projects. A quick note that although we may use gender-specific terms during this presentation, the Preeclampsia Foundation and its Mama's Voices program emphasize that all people, regardless of their gender identity, are deserving of respectful medical care. And thank you for all of those that are dropping your names and where you're from in the chat. Really, really appreciate that. So most of you are on the call are likely familiar with the Mama's Voices program, but as a reminder, our program's mission is to amplify the voices of people who have experienced pregnancy and childbirth complications or loss, especially those who have been historically marginalized, ensuring they are equipped and activated as partners with providers and researchers to improve maternal health outcomes. Our vision is that Mama's Voices are integrated as partners wherever maternal health improvements are needed. So we do all that through partnerships with dozens of maternal organizations who do such important work to ensure that Mama's Voices are integrated as partners wherever their improvements are needed. For those of you that may be new to the Mama's Voices program, Mama's Voices, which stands for Maternal Mortality and Morbidity Advocates, is the first ever maternal health patient advocates program building together real patient and family voices. We're made up of dozens of maternal health organizations who represent all types of maternal health conditions, as well as cross-cutting topics like maternal mental health, racial equity, healthcare delivery, and patient-provider partnership. We will bring together people with lived experiences, healthcare providers, and organizations who are working in maternal and infant health patient advocacy. By leveraging and uniting the shared agendas of maternal health organizations, we more effectively advocate for and move the needle on healthcare practices, systemic change, and a more equitable maternal health care system. If you run into a community-based organization, a maternal health nonprofit, or just want to learn more about our partnership program, please scan the QR code on the screen to visit our partners page or email me at nicole.purnell@preeclampsia.org. In February, we launched the Mama's Voices SUD Resource Hub, which was co-designed with women and families who have faced the challenges of substance use firsthand. Their courage in sharing their stories helps to shape better care, ensuring that every voice matters in the journey towards healing and recovery. You'll find real patient and family experiences that offer insights and guidance for providing compassionate, effective care to those navigating SUD during pregnancy and the postpartum period. Our next webinar is next week, which will be on May 22nd. If you want to join us, you can scan that QR code to sign up for that. All right, and now we're ready to introduce our speakers. I will let them introduce themselves and share with you a little bit more about themselves. First, I'll welcome Alex.
Hi, I'm Alex Colvin. I'm the Senior Director of Marketing and Communications for Sepsis Alliance. I've been with the team nearly 8 years now, I believe, and I'll go on to the next slide.
Hi, I'm Sarah McManus, and I'm a critical care nurse by background, working with Sepsis Alliance for probably 10 years or so. Currently, I'm clinical advisor.
Hi, everyone. I'm Megan Jones. I'm the Director of Community Education and Support at Sepsis Alliance. I have been with the organization now almost 4 years, and pleased to be with you today.
Right now, we're going to have the Sepsis Alliance share their screen and bring their presentation forward. Thank you for joining us today.
All righty. And again, welcome. And hopefully you can see my screen here. And I will just move forward with our maternal sepsis presentation. And you've met all of us, so that's wonderful. And I wanted to first start out with just a brief video. We always like to focus on patient stories and really hear from Megan here.
Hi, my name is Megan Snare, and my sepsis story begins after the birth of my second son. I had a successful VBAC, and we both felt well enough to go home the next day. But once I got there, I started having some intense bouts of chills. My whole body was shaking. I thought it was strange, but a lot of strange things happen after childbirth. So we just chalked it up as one of those. Then that night, I started having abdominal pain that grew more severe throughout the weekend. I had difficulty standing up, sitting down, just walking was really painful. Laying on my back was excruciating pain, worse than childbirth. It would shoot at my collarbone whenever I tried to lay down. So I called the nursing line a few times and was told that afterbirth pains can be really painful, but it was normal. And so I should just wait for them to pass. But then I started having strange shortness of breath when I would try to breathe deeply and realized that my heart rate was 3 times what it normally was. But otherwise I didn't feel sick, but the pain was all I could think about. I called my midwife again and she agreed I should come in to see her. So we made an appointment for the next day. Luckily, I didn't wait. Some onset of headaches and just not mentally feeling myself, we decided to go back to the hospital that afternoon. So I hobbled my way into the ED and triage found my heart rate to be 150 and my blood pressure was 80/40. I had no prior health conditions, so I convinced them to send me to the OB floor instead of the general floor. Once I was finally given a bed, I recounted my symptoms to multiple people. They proceeded to take labs, did an EKG, gave me copious amounts of saline, but they weren't able to get my blood pressure back up and said my electrolytes were zeroed out. My white blood cell count was nearly 40,000.
On like their
But other internists in different wards and for different points of view. And eventually, after several hours, kind of gave up. They said they were out of ideas and sending me to the ICU. So my husband took our 5-day-old baby and went home, and I went to more intense care. Once I got to the ICU, the battery of tests continued. They did blood labs. I received an echocardiogram, a CT scan, which was unbearable to lay on my back for that long. I was getting heparin shots in my stomach, swabbing my nose with antibiotics, broad spectrum antibiotics through an IV. It felt like they were just throwing things at the wall to see what stuck. My imaging showed a lot of inflammation. So the working theory for the next day was that my gallbladder was infected and needed to be removed. So I wasn't allowed to eat all day. They planned it for later that afternoon. But when the surgical team came in, he explained that he looked at my chart and my imaging and it just didn't add up. He said he didn't know what the problem was, but it wasn't my gallbladder, so they weren't going to take it out. So still no answers, but I got to eat dinner. So that was a plus. Thankfully that night, the intensivist came back and said they had received a call from the lab. And though it typically takes 24 to 48 hours for growth, one of my culture samples they had sent had seen exponential growth for group A strep. So I must have contracted it during delivery or afterwards, but it just wreaked havoc on my body, eventually leading it to develop sepsis. So he reconfigured my antibiotic regimen for the types that target group A strep. And within a day, I was feeling better. Once my resting heart rate finally dropped back down below 100, I was able to go back to the OB floor and recover there for a couple of days and then was discharged with a PICC line to give myself IV antibiotics for the next few weeks. My breast milk had initially dried up when I was admitted to the hospital, I kept pumping the whole time I was there with the support of all the healthcare team, even if it was like tiny, tiny little amounts, and was thrilled that once the antibiotics really kicked in, my milk came back and I was able to breastfeed my son for the next year. So very slowly, I was able to return to my life. I didn't need to take a nap every day. I was able to walk to the mailbox without getting fatigued. And I feel extremely, extremely lucky that I was able to go back to normal, because I know a lot of moms don't even make it home from the hospital, or they have to live a life with disability after sepsis. But I was also scared when I left, and I had a lot of questions, like, why did this happen? I'm a healthy person. Will it happen again? Will my life ever be the same? Will I be able to be a mom? And honestly, I was also frustrated. I was at one of the top hospital systems in the country, and it still took this long for a diagnosis and appropriate treatment. No one ever mentioned sepsis until they found the bacteria. But, looking back, I was thinking I never had a fever at any point, and I think that would have put up more red flags for people had I been feverish at any point in time. Also, my primary symptoms were severe abdominal pain, but I had just had a baby, so it's easy to chalk up as normal or something to do with hormones or the afterbirth. And when discharged after delivery, initially, they gave me a 2-page sheet of conditions and signs and symptoms I should be looking for in postpartum that would signal something's wrong, but sepsis wasn't on there, and none of my conditions matched up with anything they had listed, or none of my symptoms matched up with any conditions they had listed. So I just want to thank you, if you're watching this, thank you from the bottom of my heart for taking the time out of your day to do this. It's so, so important. More people need to know the signs and symptoms of sepsis. Time is everything. And even just identifying it one day earlier can really make a huge difference in someone's life. So thank you.
That really hit on a lot of points, which we'll talk more about during the next few slides. For those that are not familiar with sepsis, it is a life-threatening emergency, and it's an inflammatory response to an infection. It's not an infection itself, but it's the response of our body to the infection. And it does damage vital organs. And septic shock is when the blood pressure is dangerously low, and it can cause disability and death if not identified and treated promptly. And it is a public health crisis. The number of cases in the US each year, and this is sepsis in general, not maternal sepsis, but it does cause 350,000 adult deaths in the US each year. And from COVID-19, it was the leading cause of death of COVID-19. And we always think of stroke and heart attack as medical emergencies. Well, sepsis, like those, is also a medical emergency, because you do need rapid identification and treatment in order to save lives and limbs. And it's key and often not known that up to 87% of sepsis cases actually originate in the community. Many think that it's a hospital acquired, which that can happen, but 85 or 87% can be in the community. And just diving down a little more into sepsis in the US, it's the #1 cause of deaths in US hospitals, #1 cost of hospital and skilled nursing care, $62 billion per year. And it's the #1 cause of hospital readmissions. And almost 60% of sepsis survivors experience worsened cognitive, mental, and/or physical function. And what may not be as well known is that sepsis does cause 14,000 amputations annually. Maternal sepsis that we're going to focus on today is the second leading cause of maternal death in the US. And then more than 200 children are diagnosed with severe sepsis, and 18 die each day. And also to add to the total view of sepsis, Black and other non-white individuals have nearly twice the incidence of sepsis as white individuals. But who's at risk? Usually the very young, children less than 1 year, and older adults. 70% of cases are with adults 60 plus. And also people with chronic conditions, such as diabetes, heart disease, cancer, any immune compromising conditions. And some of the vulnerable communities are lower income, rural, racial, and ethnic minorities, and less formally educated. But the key is anyone can get sepsis. And maternal sepsis in specific is where we're going to focus now. Sometimes during pregnancy, an infection during pregnancy, spontaneous abortion or a miscarriage, induced abortion, childbirth, postpartum issues. Anytime you have an infection, it can lead to sepsis. So very prompt identification and then appropriate treatment is key. And the World Health Organization defines maternal sepsis as a life-threatening condition with organ dysfunction resulting from infection during pregnancy, childbirth, post-abortion, or the postpartum period. And again, it's the second leading cause of maternal morbidity or mortality, but the third leading cause of severe maternal morbidity. And it can occur again, delivery, antepartum, and postpartum periods. The key is that it doesn't happen that often, but it's 1 out of every 10,000 live births. But when it does happen, it's catastrophic. And the key to me is that it's estimated that 63% of maternal deaths from sepsis had a good chance to have been preventable. And for each maternal death, there are probably about 50 women or birthing people who experience life-threatening morbidity from sepsis. And again, some of the racial inequities are present, significant. Some of the risk factors for maternal sepsis, miscarriage, abortion, invasive tests during pregnancy, C-sections, which is really a major abdominal surgery, preterm delivery, prolonged or obstructed labor, ruptured membranes, hours before birth, postpartum hemorrhage, stillbirth, retained placenta after birth, multiple gestation, mastitis, where you have your infection in one or both breasts, and chronic illnesses. And again, why does it still happen? It's uncommon, but when it does happen, it can cause death. And some of the sepsis definitions are not standardized as well as they could be, and it's not often considered by the medical team. It's not uncommon to hear people recall that, you know, it took a long period of time before they figured out what was going on, because usually sepsis, you don't think of it happening because it's somewhat uncommon, but one needs to have that on your radar as a differential diagnosis. And some of the time, patients' symptoms are dismissed, so that when you present, a patient presents with a issue, people just think, oh, they just had a baby, or, that's to be expected. So delays in recognition also play a part. And also the escalation of care is slow or postponed. So when people are deteriorating, then it's not recognized soon enough and they don't get moved to the ICU or higher levels of care. And again, the appropriate antibiotics and treatment are not started quickly. As Megan in the video mentioned, why did it take so long to identify that she had sepsis? And days without proper antibiotics make a difference in how patients are treated, how they recover, and even survival. Patients and family members don't often know the signs and symptoms, and it's really unclear how to advocate for ourselves. So those are all things that are very important to remember and try to learn from. So some of the common infections, again, in the uterus from the retained tissue, the amniotic fluids, rupturing, infection from the surgery or episiotomy, mastitis, urinary tract infections, respiratory infections such as influenza, COVID-19, pneumonias. Those are all common infections that may occur anytime, and during pregnancy, birth, and after can be problematic. And maternal sepsis does not always lead to death. And luckily, most often it doesn't. However, it does cause longer stays in the hospital for mother and baby, stillbirth, premature birth, and low birth weight. So what can we do? How can we decrease the incidence? And really, the education of all is very key to doing that. We need to prevent or quickly recognize and treat infections, be up to date on all routine vaccinations, minimal badge exams during labor. If you're being touched by healthcare staff, just assuring hands are washed prior to. If you are pregnant and you suspect or you have an infection, or even for those non-pregnant, just contact provider to say you do suspect you have an infection. And report any experience of a fever following birth, increase of abdominal pain, bleeding, foul smelling, vaginal discharge. And as Megan in the video mentioned, she never had a fever. And that's also a very common misperception that you have to have a fever to be really sick. Well, it's been shown time and time again, you may not have a fever with infection and sepsis. And then just for everybody, the general public and healthcare providers alike, just awareness of sepsis signs and symptoms. If you keep that on the radar, then that can help to increase the speed at which sepsis is considered and then can be acted on for appropriate treatment. Some of just additional prevention measures, we like to say infection prevention is sepsis prevention. And you have frequent hand washing is very, very key, avoiding people that are sick. If you're in a high, close proximity to people that are sick with flu, COVID, RSV, etc., wear a mask, care for any wounds, and get help if one's infected. And another misconception sometimes is that if you are given antibiotics, if you're feeling better, don't stop taking them. Take them for the full course of antibiotics, just because it's been prescribed for a length of time to fully address the infection that you do have. Some of the initiatives I just want to point out that have addressed many of these problems are created with Duke, the Michigan AIM, Stanford, and CMQCC, which is the California Maternal Quality Care Collaborative. And together, there has been a co-led by the community redesign of sepsis care that started in 2021, a project that's actually with a grant that I was fortunate to be part of. And what was different here is it was actually the community, people that had experienced maternal sepsis that were part of the team that created materials to help with education. And it was by their experiences that we could identify some of the patient barriers and the clinician barriers. And then also looked at determining some of the characteristics for screening of maternal sepsis to help make those more specific and better than what they had been. Then in 2023 to currently, it was the implementation phase. So the first phase was really the designing and understanding, and now was the implementation. And the grant was a two-state collaborative, one in Michigan and one in California. And from the work done in the first phase, the second phase involved developing tools and resources for individuals in the community, as well as hospitals, physician offices, and then also had a collaborative with mentors and met on a regular basis within these states. And then the CMQCC Maternal Sepsis Toolkit is being revised as well. And the CMQCC has really started in 2006, and it addressed leading causes of maternal morbidity and mortality. And sepsis is just one of the key initiatives, along with hemorrhage and heart disease, many, many other conditions. And these are some of the tools that were developed. And I have to think that if Megan had received the urgent maternal warning signs tool at the top, which is available in multiple languages, she might have been able to raise her questions earlier. And again, these are maternal warning signs, not specific to sepsis, but definitely are ones that lead you to consider sepsis. The other piece that I think is so important that was developed is the advocacy language and examples for patients shown at the bottom, as well as the warning signs follow-up guide for the providers, because some of the things we've found is people don't know how to advocate. So this gives examples of how you can really speak up for yourself and have a voice. And then the other side of the coin is the provider listening, asking the right questions to fully understand what's happening with that individual. And then at the far right is a screening tool. And what this does is really call out serious infection and sepsis evaluation so that we don't wait until somebody has organ problem, dysfunction. We can identify the infection and start treatment right away at the same time. So it's created really this two-step approach to identify sepsis. And all of these tools are available on the CMQCC website, and you'll see the URL at the bottom of this slide. And again, I have to really go back to the community input was really so critical in developing the tools. It's by listening to patients and their families that we can further improve care. And one of the things Megan said in the video was how at the time of discharge, she was so frustrated and didn't really, understand what had happened and why this had happened. One of the projects that's currently under development with CMQCC and the collaborative is a period of time for a discussion that, particularly if you have a traumatic event of any kind, you have a discussion prior to leaving the hospital with your care team and family, so you can really understand what's happening, what happened, and what's your path forward and that. So this is just one of my favorite slides because it really utilizes, much as FAST was for stroke, time is for sepsis. And again, calling out temperature, high or low. You have signs of infection. Confusion is one of the key factors. Maybe you're just difficult to wake up, groggy, don't make sense, and then extremely ill for severe pain, discomfort, often short of breath. So it's by learning these key symptoms and then treating once you have identified these, it is a life-threatening emergency, and seeking help immediately. And now I'll just turn it over to Alex. Thank you.
Perfect. Thank you so much. So I would love to tell everybody a little bit about Sepsis Alliance for those who aren't familiar. We were founded in 2007 and we're the nation's first and leading sepsis patient advocacy organization. We try to be a trusted partner to patients, healthcare professionals, researchers, government, and industry. We have a strong focus on infection prevention, early recognition and treatment, hospital-acquired infections, antimicrobial resistance, as well as health equity. And our mission is to save lives and reduce suffering by educating the public and leading an alliance of patients, healthcare professionals, and partners committed to preventing and curing sepsis. We are working really hard toward a world in which nobody is harmed by sepsis. Next slide, please. And I hope many of you are aware that it is currently Maternal Sepsis Week. This is an annual observance the week of Mother's Day. It started in 2019 as Maternal Sepsis Day, and then we realized there was so much to discuss and so much to share that we needed a whole week for this observance. So this year it's May 11th through 17th, and you can, I'll say this URL many more times, maternalsepsisweek.org is our page dedicated to Maternal Sepsis Week. It has information about the observance. It has resources that can be downloaded and shared. There's lots of videos there as well. And it's really the best place to get started if you're looking to raise awareness this Maternal Sepsis Week. Next slide, please. So each year, Maternal Sepsis Week is observed the week of Mother's Day. It's an annual observance to raise awareness of the unique signs and symptoms of maternal and neonatal sepsis. And we dedicate this week to sharing survivors' personal experiences, remembering the loved ones lost to maternal sepsis, and remembering the young lives lost to neonatal sepsis. Next slide, please. So how can you help raise awareness? Following Sepsis Alliance on social media, we're at Sepsis Alliance on all channels, and sharing our posts for Maternal Sepsis Week. We'll be sharing information and resources. Yesterday, we shared the story of a sepsis survivor and her experience. We'll also be sharing information about where maternal sepsis comes from. As I'm sure many people on this call are aware, due to their work with other organizations, any infection can progress to sepsis, and our maternal patients can be even more at risk because of everything their body is going through. So many of the organizations on this call have probably heard from people in their network about maternal sepsis. So we're working to raise awareness and share all of the different ways that people can acquire it. Also sharing videos and graphics from our site with your network to help raise awareness of the causes, signs, and symptoms of maternal sepsis. And then also sharing our Faces of Sepsis experiences with your network to help people understand the real people touched by sepsis. We always find that's the most effective way to help others understand is when they see that, oh my goodness, this happened to somebody else just like me. Next slide, please. As I mentioned, at maternalsepsisweek.org, we also have lots of videos. This sepsis pregnancy and childbirth video on the left side comes in English and Spanish, and this is a little more designated for healthcare professionals. It has a deeper dive. We have Dr. Melissa Bauer speaking on it. And then on the right side, these three moms share their stories. We have Amanda, Kaylee, and Miley sharing their stories of maternal sepsis that are all extremely powerful. And that is everything I have on Maternal Sepsis Week, but I am here if you have questions or thoughts or ideas. If you want to find a way to get your organization involved in Maternal Sepsis Week and would like to discuss that, I'm always happy to do so. So yeah, please, I will drop the URL as well as my email address in the chat for anybody who has questions. And thank you so much for being here today.
Thanks, Alex. And then I will jump in and share just a little bit from our public awareness, education, and support perspective at Sepsis Alliance. Alex did a great job talking about Maternal Sepsis Week specifically, and that maternalsepsisweek.org webpage is focused primarily kind of from the awareness building angle. And so I'll talk a little bit more on the education and support side. And specifically in the next couple of slides, I'll cover things that you can find on our sepsis.org website. I'll also touch on Faces of Sepsis and where you can find that on our website. I'll take some time talking about some educational content that you can find, and then also Sepsis Alliance Connect, which is our virtual support community for anyone who's been personally impacted by sepsis. Next slide, please. Thank you. You read my mind, Sarah. All right. So starting then with the resources that you can find on maternal sepsis on our sepsis.org website. You'll find videos, a fact sheet, a downloadable guide, and other information there. And you'll see a screenshot on your screen of our website. It's sepsis.org. And then if you hover over the navigation menu for under sepsis basics, you can find it right in that right-hand column where it says pregnancy and childbirth. So that's the easiest way to get to those resources. And I'll drop that in the chat as well when I'm done speaking. Next slide. Thank you. Faces of Sepsis. The best way to get there is just by going directly to facesofsepsis.org, but you can also find it on sepsis.org as well. As Alex mentioned, these are really the stories of people who have been impacted. They've either submitted these stories themselves in the cases of survivors, or we also have, unfortunately, tribute stories. So stories that have been submitted by a loved one of somebody that was unfortunately lost to sepsis. And if you go to facesofsepsis.org, you can sort these stories if you want to read only survivor stories or only tribute stories. And then you can also pull them up using the pregnancy and childbirth tag to find just the maternal sepsis stories there. Next slide, please. Sepsis Alliance Connect is something we haven't really touched on so far today, but really just something that we launched about 3 years ago now. It's something we're really proud of. This is our virtual support community for the millions of people affected by sepsis annually, some of whom, as we've discussed today, are maternal sepsis survivors. And this includes survivors, caregivers, and those who've lost a loved one. We do approximately 15 virtual programs a month in this free platform, also discussion boards, and we've got more than 4,000 members now. And so this, I think, is relevant to this community just because, as Megan in the video shared, she was able to go back to life mostly as normal after her experience, but a lot of folks unfortunately are not. And so for folks that are, living with a life changed by sepsis, at least temporarily, whether that's because of an amputation or something maybe less tangible, but still just as impactful, such as, cognitive challenges, things like that, having a community where they can seek support and others who have been through something similar is really important, and we're thrilled to be able to provide that. And that is it from me. So I will add my thanks to that of Alex and Sarah that they already shared. We're really just thrilled to be able to be with you all today and to share in this important work you're doing and provide some additional resources as well. So thanks so much.
I'm gonna give my video on. Thank you all. I just wanted to open up the opportunity if you have any questions I didn't mention this at the beginning, but if you have any questions that you wanted to ask our partners at the Sepsis Alliance, now is a great time to, you can either come off mute, raise your hand, or drop things in the chat.
And I'll just add while people are thinking of some great questions, you know, the videos that Alex, Megan, and myself mentioned, those are great tools if you are a healthcare provider to use in your unit meetings or to kick off any programs you might have, because really bringing it back to why we're there is so important. And it really, I think, speaks volumes. We could probably take another 5 minutes just to really reflect on Megan's video and all the points that she brought up, and just all the things that takeaways, you know. So I'll wait, and hopefully we'll have some questions. Otherwise, maybe if we don't have questions, we could have everybody add in the chat one of their key takeaways from Megan's story now after a deeper dive into maternal sepsis. But I see we have some questions. So Nicole, I'll let you handle the Q&A.
Sure, I do. I see Sherry, I've got your hand raised. If you want to come off mute and ask your question.
Sure, thank you. This has been very informative. I lost someone very close to me due to sepsis. I didn't have the language at the time, but I knew something was very wrong. And they were exhibiting all of the symptoms, right? And my pleas to healthcare providers were pretty much ignored, and the person unfortunately succumbed to sepsis. I appreciate that you have advocacy. You have a infographic in terms of to help you with advocacy language, but I couldn't read it. Could you offer some talking points when you're in a position in a hospitalized environment and you're advocating on someone's behalf, but medical personnel, are not keyed in to the signs and symptoms of sepsis? What are your next steps? What do you say? What do you do?
Yeah, and first of all, I'm so sorry to hear that you had that experience. And I'd like to say that it's uncommon, but unfortunately, it happens way too often. And that's why we want to do something to change the trajectory of this. I think what we can do for sure, Nicole, do you do a follow-up email afterwards? We can do the link and even include, to the advocacy language, and for those providers, how to respond. I think one of the key things that happens is the dismissal, as I mentioned, also kind of denial. It's like, oh, that's really not, because people, especially in maternal settings, it's like a happy place, and you don't want to have anything bad going on. So you kind of deny, and since it is fairly uncommon, you think, oh, chances are not. So, it's like, how do we avoid having those things happen? If patients and their families can raise what's the signs and symptoms, and oftentimes it's saying, I'm concerned about sepsis, and calling it out, because then it places it right there. Or have you considered sepsis? Because that brings it to mind, because no healthcare provider is wanting to do harm. I mean, that's not why we work. We want to help and heal. But sometimes, you get tunnel vision, but just raising that word sepsis brings it up. Have you considered, or I'm concerned about? So some of that. And I think for the provider side of it, it's if somebody following childbirth calls and says, I'm just not feeling well, I have aches and I think I have an infection. And, you know, the person at the other end on the provider side said, well, you know, you just had a baby, so you're bound to be tired. But taking it a further question is, how tired are you? Can you go up a flight of stairs? But really, no, I can't get off the couch. I can't even walk. Really finding out those really definitive, taking the time to really understand where that person is coming from. So those are just a couple of things, but I think having that paper as a guide, you know, maybe even taking a picture with your phone, and just because those are maternal sepsis advocacy, but when I read through those, they're really all but maybe one for any advocacy language.
Yeah. Thank you so much. Yeah, curiosity and the vernacular, right? To call it out,
Mm-hmm.
right? Because otherwise it's just something's wrong. Well, what's wrong? I don't know, but something is wrong, right? And then what happens is there's this deferral to the white coats, right? It's like, okay, they have MD after their name. They're telling me that, oh, you know, it's par for the course, whatever the person may, whatever malady, right, the person may be dealing with, whether it's, you know, postpartum recovery or, you know, recovery from a minor procedure or something like that. And then, you know, you just kind of give over your power to them because you assume that they know best.
Mm-hmm. And the key is, like you said, I mean, you know yourself, you know your loved ones, you have that purview that the providers don't know. You know, this person, they usually do this, and this is very different than their normal.
Yeah. Thank you.
I see a question in the chat from Tanae. What reasons do medical professionals give for people of color having more instances of sepsis?
Oh, that's a tough one. And I think you know, it's one of those no easy answer. I think a lot of it is, you know, with anybody, it's appearing at a doctor's office, emergency room, maybe even a phone call. Um, you know, it's not hearing the person, dismissal, you know, it's, I don't know. I think probably the best thing I can do is really get a study, and we can provide that link.
I did. Sorry,
Okay,
I did hear a study with link.
and Alex, feel free, Megan, to add, but I think it is complicated. It's access to care. I think even taking it further, when we look at the maternal crisis that's happening in rural America, I think access to care, it's being aware of the signs and symptoms for everybody. If you don't feel comfortable going to a provider or facility, you're going to wait. And probably going back to our time, you know, time is critical. So if one doesn't seek or get treatment promptly, then that's going to be so impactful on what happens.
One of the things we talk about in some of the quality improvement projects is also about cognitive bias and normalizing bias as well of, oh, that's okay. Oh, that's a normal pregnancy symptom. Oh, you know, in justifying the symptoms that a patient may be expressing that they're experiencing. And so those are some things that come up and we've seen as well.
And I think language barrier, you know, for some is, you know, how are you hearing the discharge instructions even if English isn't your first language? and the communication back and forth. And that's one of the things with the early warning signs that was developed. That's available in, I think, 30 languages. So understanding what to look for and being able to voice it, I think, are key components.
Yes, so many of the early signs of sepsis, and this goes back to Sherry's advocacy question too, are a little bit subjective. And so I think getting to what Sarah just said about biases, I mean, if we're talking about things like mental and cognitive decline or things like extreme illness, those are hard to measure in an objective way. So they depend so much on the communication that is happening between patients and family members and providers. And so that is just a really much more complicated thing than taking someone's temperature or blood pressure or things like that. And obviously those play a part in the diagnosis of sepsis too, but often maybe not as soon as some of the other symptoms.
It's like, are there any other questions? The chat's been so engaging today. And so many folks that I see, I'm seeing a ton of folks from Texas, which is amazing today. I know we're working on a sepsis project kicking off very quickly. So happy to see that. Again, if any of y'all want to connect with the Sepsis Alliance, they provided their information in the chat. We'll capture the links too, and share those out with our after meeting recap, as well as the link to the presentation if you want to watch it again or share it with a coworker or a colleague. I do see one more question coming into the chat. But before I get to that, there's also, as a reminder, if you have any patients that you or know anybody that has experienced sepsis, you can connect them with Megan and their resources there. You can also connect them with Mama's Voices. We're always looking for more voices for sepsis, specifically in Texas right now. Put that plug in there to work on our sepsis projects. So we would be happy to connect folks with the resources that are developing. So Allison asks this question: does your organization define maternal sepsis differently than obstetric sepsis? I see both terms used interchangeably, but they seem to carry different connotations.
No, they're the same from my perspective. Megan, Alex, would you agree?
Yeah, we use maternal sepsis. We don't use obstetric sepsis in any of our materials, and I'm not a healthcare professional to comment on any differences, but maternal sepsis is what we use to encompass.
And obstetrics is really the care of a patient. So I'd say maternal sepsis is the condition, and the patient.
Well, so many of the cases are postpartum, and so you're past that OB range too, would you say?
Yeah, and I think that's probably the best reason why you would focus on maternal versus, I think of OB as not just being labor and delivery, but not everybody does.
Mm-hmm.
So I think the broader that encompasses all the periods of time, because it's pre, during, post. So any of those times, because as was mentioned, the physiologically, you're at more risk during that period of time for infection, which makes you more at risk for sepsis. The other thing I want to mention, we talked about the key is education and knowledge for the community healthcare providers alike. And I think one of the facts about CMQCC and the work that was done when it was started in 2006 until 2016, there was a decrease of 65% maternal mortality. And this is like all cause, not just sepsis, but all maternal mortality. But to make such an impact of lowering it by 65% in 10 years, that's significant. So imagine, you mentioned, Nicole, like Texas, and I know New Jersey's working on it, and we did the collaborative in Michigan and California. if every state decreased it by that much, it would be just amazing.
Great question, Linda. Does anyone know when the new sepsis recommendations from CMQCC are going to be released?
The latest toolkit is available now.
Okay.
And I believe it's constantly being updated. I think in the next month or so, like the total toolkit, but like the two-step, I think that is like an ongoing revision just to make sure it's the best. But if you go to that website, they'll have the latest and greatest there with what can be used.
Will a recording of this be made available? Yes, April, it will be. And we will be hosting this on our YouTube channel. It'll be up in a few days. And then we'll also send out an post-events email to everybody that registered in case they missed it as well. That will include the links and resources that were mentioned today, as well as the recording. So we had a really wonderful registration for this and those that showed up in attendance. It was really nice crowd today.
I have another real quick mention that might be helpful to those on the call from as a healthcare provider. Sepsis Alliance offers the Sepsis Alliance Institute, which has courses available, and there are, I think, at least 6 or 7, maybe more, that are specific to maternal sepsis. One was, every year during Maternal Sepsis Week. And I'm blanking on, Alex, when is the webinar for Maternal Sepsis Week? Maybe we could put that in the chat.
Believe it's tomorrow, but I will share it in the chat.
That'd be awesome, because this is a great opportunity to really focus on maternal sepsis as a healthcare provider. And previous years' courses and those courses that were presented during the Sepsis Alliance Summit in the fall, you can go into Sepsis Alliance Institute and you can search for maternal sepsis. Sometimes pregnancy will pull it up too, I believe. But those are courses that are recorded, and for nurses, you do get contact hours for those as well.
All right, we have time for maybe one more question if there's anything that hasn't been answered or comments. We're right at the end of our time together today. It's been fantastic. Jamie, did you came off mute? Do you have a question?
Yeah, what do you pay for?
Or not?
I just want to thank everyone for joining, and together with all of our efforts, I think we can really truly make a difference.
Bye,
and
Tim.
Save lives and improve care.
Thank you. Well, thank you everyone for joining us today. Thank you for the Sepsis Alliance for coming and presenting and sharing some information about sepsis. And we will see you all again. We'll see you soon.
Thank you.
Thanks, everyone.
Thank you.
Thank you.
Muchas gracias.